that started or triggered the distress in the client. Am I clear?
Ma'am, is there any time limit in which that needs to happen or something?
Yes, yes. Precipitating, see the mode of onset. In the mode of onset, we have discussed there may be sudden, acute, or insidious onset. Okay. When it is insidious, we cannot find the precipitating factor because it is over 2 weeks, 3 weeks. But it is within 2 weeks. We can, if it is within 2 weeks, 3 weeks, maybe till 6 months, we can identify a precipitating factor. Okay. It happened. Okay. Hmm. Okay. So moving to biological functioning. In biological functioning, there are, four things that we need to identify. One is sleep, appetite, sexual interest and activity, and energy. These four things. If there is any change, we need to note it, that it is increased, decreased, or unchanged. If a person loves to sleep, okay, was like that, okay, so it is unchanged. But if there is any change from the baseline, what is the normal activity? Negative history is very important. Negative
So
history
moving to
is what
biological
is
functioning,
not
in
there in the
biological
client.
functioning,
There are a few things, symptoms that we need to rule out, that it is not there. Okay, we were talking about depression. Depression is there, low mood is there, but there is no, episodes or insta elated, very happy, any grandiose ideas. So by writing that, what we are doing, we are ruling out mania, because we know that depression এর সাথে mania অনেক সময় থাকতে পারে। তো এইবারে সেটা নেই, it is not the case this time. Okay, so we are ruling out that. You may know that with depression there can be psychotic episodes, delusions, etc. So we need to rule out that it is not there. There is no suspiciousness, there is no ideas of reference, etc. with present with this client. So we are ruling out psychotic symptoms here. And two things we generally rule out for every cases. One is organicity. There is no epilepsy or things like that. There was no head injury. Okay, so organicity we need to rule out. And another thing is substance abuse. Excessive use of alcohol or any substance. Okay, these two we need to rule out for every cases, and for the others we just need to rule out the relevant symptoms that may occur but presently not occurring with the index client. Okay, moving to the family reports. Because of a child is saying something and parents are saying something, two puro different stories. And with some personality disorder cases also, there are different stories. So you need to have both accounts and then corroborate what is happening. Coming to family history, I'm not just elaborating on the role of family that plays in a disorder or function. You may know that there are major influence of family in the formation and maintenance of and relapse of the psychological disease and disorders. So what